Wendy's initial presentation was someone that was very active, that had terminal dentition or failing dentition, and only had a handful of upper jaw teeth that were left and had lost several teeth over the previous months, had significant bone loss that needed to be addressed. So it was an overall reconstruction of her upper jaw that had to be done. One of the biggest challenges with Wendy's case was the state of her current bone, right? How much excess she had in terms of how tall her upper jaw was. She was showing a lot of tooth show, a lot of gum show that had to be reduced to get an appropriate restoration. But then, even though it had plenty of height, it was very deficient in width, so very thin bone. That was one big factor. The next factor is she had really large maxillary sinuses, so very pneumatized, and also had very thin zygomas, so that makes it hard to do zygomatic implants in a situation like hers. So she kind of had a trifecta of challenging conditions. The biggest challenge using a traditional approach for Wendy's case is it would require a significant amount of bone grafting, which includes sinus lifts to help increase the height for her maxilla, buccal bone grafting, allowing that to heal for about 6 months, and then trying to attempt to place dental implants in. And none of that's guaranteed, right? It's an alternative, it's an option, but not every bone graft is going to be successful and get her to the result that she wants. Other thing was looking at zygomatic implants as an option for her treatment. But again, looking at her CT scan, her zygoma wasn't thick enough to actually place 2 on each side. So that's what brought us to the KLS preprosthetic or subperiosteal. It's an ideal solution for a patient that has these anatomical abnormalities. It spares them from having to go through lengthy and multiple procedures with variable success rates and is able to give us a customized implant that fits exactly for her case. The moment where both Dr. Ryan, her prosthodontist, and I decided that this was the ideal treatment for her was when we were sitting down looking at her CT scan. And Dr. Ryan from the prosthetic end was explaining to me how much bone we had to reduce to get her to a good natural smile line, and then evaluating her sinuses and looking at the thickness of her zygoma. We knew at that moment this was the only option that she had for an immediate fixed restoration.
It was crazy.
Yeah.
Because I was fine, and then the root canal, the root split, the crown fell out, the tooth next to that fell out.
Yeah.
I ate rigatoni and cracked another tooth. I mean, it was bizarre.
Yeah.
So
in terms of the overall treatment process for patients like Wendy, it's obviously the initial consultation, obtaining your images, photographs, cone beam CT scan, maybe some digital imaging as well of her dentition, and then sitting behind the scenes and doing all the digital planning to see where would be the ideal position to place implants if they're an option. In Wendy's case, when we're doing a pre-prosthetic implant, it's a lot of work with the engineers at KLS, where we sit behind a computer and do a virtual surgical session, essentially, where we map out exactly where the bone reduction is going to be, where our bone guide is going to be placed, as well as how the prosthesis is going to be designed and how many anchor points or pillars that we need.
After the product is designed, KLS puts Dr. Salman and I on a virtual conference call. We took a CT scan here in the office. They bring together a 3D interpretation of our patient. I'm looking at it in terms of the tooth form, how the implants are in reference to the incisal edge, the patient's face, symmetries, all of that. And basically the surgery is done before the surgery starts.
And it's done in an outpatient setting. Usually takes about hour 15 minutes to complete the surgical procedure. And at the end of it, she has a full set of teeth that are fixated or screw retained into the prosthesis and gets to go home, and at least go home on a soft diet so she can function. With the option or the availability of the KLS IPS product, it opens the door to a large group of patients that previously had no restorative options. So they would either have nothing or a denture that would come in and out. But now with this product, we essentially have that solution for all of those patients.
Dr. Salman and I have done treatments like this many times. We worked with KLS before, but we always pivot and we put all of the options out there for each patient so that there's no one pathway. But it was very evident in her case where KLS subperiosteal implant was really the only option. We didn't have another choice. We knew it was the best foundation for the most natural and functional tooth form we could find, and there wasn't another option. There wasn't a better option at all. KLS is every single patient is different, and one implant's not going to fit the next patient. Everybody's unique, everybody's different. It's form-fitted. So the subperiosteal implant provides a permanent solution. Teeth do not come in and out. We knew that. That guided our major decision making. Its foundation is very secure. It gives lifelong stability for our patients. And we wanted to complete it once and forever. So Miss Wendy wouldn't have to revisit doing this again. And this was it.
I guess my message to other surgeons that are out there that are interested in this product, it's definitely worth looking into for your patients that have had struggles with dental implants, with bone grafting. You've had challenges with trying to get them to where they want to be functionally. I think this is a good solution for those patients. So just keep it in your back pocket. Know it's an option. Know that it's the patients that you might have thought that didn't have an answer or a solution before, now you have an alternative.